Welcome to the Wilmer Glaucoma service, especially for those who are coming to do an interview virtually with us today. The glaucoma service has a way in which we see patients, in which everybody who's a patient comes in and checks in with Megan or Lou at the front desk, and then sees one of the technicians. Each technical room has an examining space and a visual field machine. Then the patients come across and wait to see the doctor, unless they're getting imaging today, and I'll show you the imaging room in a moment. You'll notice, thanks to our recent infectious disease issue, that we've made things safe by increasing the social distancing here in the area, as well as putting up plexiglass for the staff to protect them. Come on around the corner. The imaging that we do here is with several instruments. While we do some endothelial cell counts, we do refractions. The main imaging instruments used in our service are the Cirrus imaging device, although we have a non-mydriatic camera on that end. We have spectralis in the back where we're doing some research-oriented imaging. Let's go out to the doctor's rooms. Each of the physicians here has a major research interest, and our patients always like to see the pictures of the staff, old guys and young guys, and women. Here you see, just as an example, Dr. Ian Pitha, whose research involves new alternative tube shunt surgery, Dr. Yohannan, who's working in artificial intelligence, and I have both clinical and laboratory interests. We have two main setups for how we see patients. The main rooms are very often set up so that in sitting and talking to the patient, you could be the 6 feet away but still be working on the computer. Every one of our examining instruments has, in this area, stereo assistant slit lamps. In that way, when I'm looking gonioscopically or you're looking at an optic disc, I can see in stereo and you can see in stereo. And we've over the years proven that that's really the only way to learn how to do important glaucoma examinations. This room has our YAG laser for both PIs and SLT. And the second main setup room is my favorite room. And in this room, the doctor is standing for much of the day, which is good for your circulation, great for your exercise. We have two screens, each one of which shows aspects of the patient's care. Here's a patient's record in Epic, and over here is Forum, where we can see the patient's imaging and fields simultaneously with it. We can go back in time. For many of my patients, that's going back 18, 20 years in the same software, and bringing up their testing so that while we're looking at the patient, we can be looking at their imaging. And very often that's the most important aspect of putting together the entire thought process about each patient. Once again, the slit lamp here has a stereo assistant viewing port, protected now by plastic so that we're not breathing on the patient and the patient's not breathing on us. We limited most patients now to no family members in the area, which allows us to be at pretty much 90 to 95% patient visiting capacity compared to before COVID-19. Let's head on out. I want to show you the research room. We find that doing research during our actual patient visit days is the most efficient way for us to recruit patients for many of the studies we're doing. So we have a room in which imaging research is done. As you can see, the Heidelberg spectralis is over here. There's an IOL master here, and quite soon we're going to have a second imaging device here. Both a postdoctoral fellow and one of our assistant professor faculty members, who is an expert in adaptive optics, will be carrying out imaging going on here in real time while the patients are seeing us in clinic. Let's head on out this way. Then the remainder of the area in the glaucoma service back here are research rooms where patient interactions by questionnaire, by other forms of examination can go on in real time. Here's another of the posters showing the research ongoing by more of our faculty. Dr. Tom Johnson, who's doing stem cell research, Dr. Henry Jampel, who's editor-in-chief of Ophthalmology Glaucoma, Dr. Randy Craven, who's one of the more foremost MIG surgeons in the world, and whose main practice not only is here, but also in one of our several satellites. So while I'm showing you today the East Baltimore site, we also have fellows who see patients with us at Green Spring Station, at the Bayview site, at Columbia, and at the Suburban and Bethesda sites in the area near Washington, D.C. Typically, you'd be with us for a period of 4 months at this site, 4 months at two other sites, and 4 months at 2 other sites. Though we'd see you every week, and we have educational sessions. Those normally would have gone on out there in the patient area. Let's walk back out. Normally on Wednesdays, we have essentially a weekly journal club. And that's a 1-hour session at the end of Wednesday clinic. And thanks to our recent pandemic, we don't all sit out here, but we all Zoom it together. And frankly, I think as terrible as the pandemic has been, it's been rather worthwhile at getting more of the faculty together for those meetings, because in the past they would have said, well, you know, I'm down in Bethesda, so I can't come to Journal Club today. Now everybody can be here at the same time. We all Zoom in at the same time. And I think we have not only our own faculty, but people who are visitors for the day. This week we had Dr. Paul Palmberg, one of the most distinguished glaucoma specialists in the world, who did Journal Club with us on Wednesday. Dr. Alan Robin is with us very often. We've had Steve Getty from Bascom Palmer, Joel Schumann, Claude Burgoyne, each of those people doing a weekly session here, and of course they do that in their own home institution.